Hi, my name is Ken Davis and this is the Ken and Phil's Health and Safety Podcast. This is a podcast that's aimed for our partners and supply chain and giving them a little bit of access to informal health and safety chats and informal health and safety topics.
Today's first topic, I want to talk about the control of substances hazardous to health.
Wow.
Sometimes known as COSHH regulations.
Yeah.
Okay. So why have I chose this? Well, I think in recent years we've been guilty of taking our eye off the ball and focusing far too much on accidents.
Yeah.
And incidents and and those physical sort of acute type situations. And
how do we define that in health and safety terms? Am I right in saying it's the acute scenarios where accidents happen, and we tend to focus on that?
Well, yeah, that's really why I've chose this topic, because would you believe that last year in the UK, nearly 12,000 people died of a respiratory related disease brought on or made worse by their job.
Yeah,
we only killed 137. I know it's like, I'm not being sort of flippant about that, but that's how massive the discrepancy is between fatalities from an accident point of view and fatalities from ill health. So I thought it'd be an excellent topic to do.
Absolutely.
So what's it all about? Well, obviously we're trying to stop manufacturers of consumable items like paints, activators, thinners, adhesives, putting all sorts of really nasty products in their items that we buy as consumers, and then we get exposed to those awful types of diseases that can be brought on from breathing in the fumes or the vapors or the dust, etc. So that's really what it's all about today. So I want to focus on ill health and disease.
Ill health, okay.
Because
correct me if I'm wrong, but if we are looking at COSHH as from an employer's perspective, what do they have to do in relation to the Health and Safety at Work Act?
Well, yeah, I mean, obviously the Act is up there. Remember, this is a regulation that feeds into the Act.
Yeah.
And I really want to come on to that later in a bit more detail, if that's okay, because I do want to know I want to make it clear that our listeners, our partners understand the basics of what the law requires them to do. And rest assured, it is pretty straightforward stuff.
Yeah.
And it is the same as all other regulations, essentially, which is to assess that risk and to make sure our employees aren't exposed to anything greater than tolerable.
Does that come under duty of care, does it?
Yeah, well, again, that's kind of sort of like civil law and stuff like that, but I don't want to get down in all that. Good questions, but I'm going to come on to that in a minute.
Okay.
So this is a really important question. What is a COSHH-affected substance?
Yes.
You know, because there's a load of products that come in bottles or containers or boxes, and it tells you, you know, there's big skull and crossbones, or there's an explosive symbol, you know, all of those things. But there's an awful lot of COSHH-affected substances that we know very little about, because you know, we're mixing chemicals, two inert chemicals that might produce something explosive or harmful, or generate a dust or a vapor
reaction.
Yeah, or it might be a cutting process where you're creating dust. You know, hardwood dust is carcinogenic, or it might be a cutting process where you're chopping a brick on a building site, generating silica dust, which was responsible to 600 deaths last year. Due to silicosis. So chemicals that are affected, obviously products containing chemicals, like cleaning solutions, dusts, vapors, gases, mists, nanotechnology, amazingly enough, is
nanotechnology.
Don't ask.
How do we define nanotechnology?
I think it's used an awful lot in the healthcare industry, where we can inject people with certain tailored chemicals which attack certain,
like cancer drugs.
Yeah, exactly. Cancer treatments are using nanotechnology quite a lot. Biological agents come under the COSHH regulations. Yeah, so obviously we know about COVID, but you know, lots of industries like anybody who works near sort of in the ground or near rivers, they'll always be exposed to potential sort of rat urine, so leptospirosis, or more common Weil's disease. Exactly. And obviously we ought to mention at this stage that today's topic is COSHH.
Yeah.
But DSEAR, obviously the Dangerous Substances and Explosive Atmospheres regulations, essentially is asking very, very similar stuff. But obviously DSEAR focuses on substances which explode or can oxidize or are flammable or highly flammable.
Yeah.
So again, I'm not going to overly complicate this. This is an informal chat.
Yeah.
COSHH and DSEAR have a massive overlap.
Yeah.
So I hear you say, what does the law require us to do or require the employer to do? So if you're a manufacturer of a COSHH-affected product, you must provide a data sheet to anybody buying your products. Okay, or you task somebody, an agent, to provide that data sheet on your behalf. So that's a key part, remember? So the COSHH regs is focused on people making harmful substances.
Yeah.
And really, we want them to make them less harmful.
Yeah.
And one of the key tools to do that is to make sure that people who read the data sheets see that it's harmful, see that it's cancer forming, see that it's explosive, see that it can sort of generate all sorts of long-term chronic disorders, to move away from that product.
Yeah.
And use a harmless product or something less harmful.
So why don't employers embrace the statement that you just said in relation to reducing the risk and obviously spending a bit more money?
It's a great question. I think it's ignorance. I think there's a lot of senior people, not necessarily senior, middle management in a lot of organisations that don't know how to manage health and safety. And why should that? You know, I mean, obviously you've got to be trained, you've got to be competent. And if you're looking after other people's health and safety, you know, it will be expected that you've got a qualification to do that. And I think people get promoted through the process of, you know, within a business. And maybe it is in certain industries, not necessarily all, but in certain industries, you can get quite a long way up the tree without actually having any formal health and safety training, which is shocking. Just to go back then to COSHH data sheets, the data sheet must be compliant with CHIP, Chemical Hazard Information and Packaging Act. So I don't want to sort of overcomplicate it, but CHIP is the...
is that a regulatory body?
Yes, yeah, absolutely. It stands for the Chemical Hazard Information and Packaging Regulation. Yeah. So it's a regulation, and it's simply saying that the data sheets have to be consistent, following 16 categories of information. So these manufacturers of harmful products have got to provide you a data sheet that's CHIP compliant.
Yeah.
And obviously that gives the consumer then an insight into what's in the product. Mm-hmm. Because not only does it tell you what's in it, but it'll tell you how it can harm you and how it can get into the body system, etc. So, and it is also an incredibly important tool to assist you in your risk assessment. Yeah. Because yes, believe it or not, like every other regulation, COSHH, if you've got a substance which is presents a significant harm, and it's foreseeable, you've got to write it down as a risk assessment. So you can't do a COSHH risk assessment, really, a suitable, sufficient one anyway, if it is not assisted or you're not assisted by an MSDS, because you've got to know the ins and outs of that product.
MSDS, that is stands.
Sorry, I shouldn't do that, should I? It's my military training.
Do you want to tell our listeners what MSDS stands for, please?
Yes, thank you. It's a material safety data sheet.
Yeah.
Most people in the world call them a COSHH data sheet. Yeah. Okay. Yeah. Thanks for letting me know.
No problem.
Okay. So next question for us is, what does the law require us to do? So if you're a consumer of a COSHH-affected product, as I've said before, you need that data sheet provided to you free of charge. You've got to maintain that data, you know, so if you've got 20, 30 products which are COSHH-affected, you've got to maintain a file. And then obviously from those data sheets, those significant hazards would need to be risk assessed. So there's more data that you've got to provide. And remember, it is a legal requirement to bring these documents, both of them, to the attention of your staff. It's no good having all your risk assessments and COSHH data sheets in the boss's office. This has to be communicated to the people who are exposed to those risks. Okay. And remember, as we said in our risk quantification podcast, you can only expose people to tolerable levels of risk.
That's a really good question, Ken. So as an employer, how would I define tolerable?
Yeah, brilliant. So the risk assessment document that you employ will have some sort of quantification on it. If it's low, medium, and high, as a sort of as for instance, the college's risk
As an
assessment.
outcome.
Yeah. Low and medium is considered tolerable.
Yeah.
If you're using the other style of risk assessment, which we would call there's quantitative and qualitative. So the qualitative is low, medium, and high.
I'm glad you said that.
Quantitative is where you're calculating that risk using numbers, so the likelihood times cost.
That's a 5 times 5, mate.
Most organisations would use 5 times 5, and therefore 12 or less.
Yeah.
So that's obviously going to be a sliding scale of 1 to 25. So 12 or less is considered tolerable.
Yeah, I mean,
The closer you are to 12, the more.
yeah, I mean, obviously, when you do your risk assessments, you're looking at the significant hazards anyway, aren't you? First of all.
Absolutely.
Yeah.
Absolutely. So if it's not a significant hazard, it doesn't need to be risk assessed. We still need to manage it, but
Yeah,
we don't need
absolutely.
to
Yeah.
cut it down.
Yeah.
So a quick point that I'll talk about in terms of controls just before I move on is be aware that if you are using extraction as a control measure to take away a mist or a vapour or a fume, belly dust, local exhaust ventilation, LEVs, the COSHH regs does stipulate that they have to be statutory checked every 14 months.
Oh.
I hear you say, why 14 months? Well, it's essentially every 12 months.
Yeah.
But it gives you 2 months then grace, so you're not breaking the law. So if you do go a couple of days over 12 months, it's not breaking the law. So you have to have statutory checks, just like under LOLA or PURE or the fire reforms. You've got to have sort of statutory checks on your extraction.
So that's to make sure there's actually controlling the air in and around where you're working.
Yeah, exactly. So obviously, if it's a bit like PPE, if that doesn't work, you're exposed to that harm then, and so it's critical that we make sure that it's working efficiently. So there's a little bit of extra admin there that needs doing.
Mm-hmm.
Some of the difficulties that we might experience when looking at COSHH is the non-typical situations. As I've said before, you might be mixing two chemicals that might expand or give off fumes or could potentially become explosive or what have you. So just be aware. Now, where do you get the information that tells you all about the product? The data sheet. So, reading the data sheet and understanding it is as important as reading and producing a meaningful risk assessment.
Yeah.
So a classic example would be, you wouldn't necessarily do a COSHH risk assessment on a brick.
No.
I've got a brick here, it's pretty inert. It's a solid item.
Yeah.
But when I start grinding that brick with a grinding wheel and generating silica dust that's sort of tiny particles which can be inhaled, we then have a major problem. So that process, although it's not a harmful product that you're bringing in, we've got to make sure
Once you start working with it.
We've got to make sure that our processes that might generate harm via substances are also on that list of things that need assessing.
Yeah.
Remember, I opened up today's session with 12,000 people last year died of a respiratory-related disease. 5,000 of those are still asbestos-related. 600 of those, which is the second biggest group, was silica dust, which is breathing in silica, generally from the construction industry. So should we talk a little bit about the hierarchy of controls?
Yes.
So obviously we can apply this to the risk assessment process, but really it's a management tool that we should be applying in all of our working day anyway. So, it's subtly different under COSHH than the one that we've talked about when we did our risk assessment podcast. So yes, first of all, we want to try and eliminate the substance and replace it with a harmless one. Examples. When I was back in industry, we were using 1,1,1-trichloroethylene, which is a chlorinated solvent, which was really bad for humans and really bad for the environment.
You're using that in a bath?
Yeah, we were just degreasing metal components. But we moved away from using these chlorinated solvents, which were harmful to us and the environment, and replaced it with essentially washing up liquid.
Yeah.
Made out of citric acid. which is harmless. Well,
Ultrasonic, a lot of
mild harm
now, aren't they?
Yeah, obviously ultrasonic is a really good way of cleaning products, but if you can imagine getting rid of trichloroethylene, it was thousands of pounds.
Barrel vapor and a mist, didn't you?
The actual container cost thousands of pounds. The sort of, and then obviously you've got to do those risk assessments. You've got to comply with the COSHH regs. You've got to do all that training, and get rid of it with something harmless, and you haven't got to do any of those, and nobody can be harmed, nobody can be prosecuted for not complying with the COSHH regs. So elimination is still the first choice. Second choice is substitute.
Yeah.
So if you can't get rid of a harmful substance, use one that's less harmful. A classic example would be, I've done a lot of work with the schools in the Wolverhampton area, and historically cleaners were using bleaches.
Yeah.
Bleach is a really harmful corrosive. It's kind of like using a sledgehammer to crack a nut, really. So bleach is really bad. So why don't we replace it with a water-based cleaner?
Yeah.
It's not totally harmless, but it's a mild, and some of them are, actually. I've got to say, some cleaning solutions are harmless, but
they're abrasive, aren't they?
Yeah. So substitution with something less harmful. We then get into the mechanisation, so LEV, segregation of the operative from the process, those in containment, guarding. Admin controls, so obviously training, supervision, safe systems of work, method statements, risk assessments, obviously.
Can I just, would a wells come in there?
Yeah, work exposure limits are given to you in your data sheet, and some of the worst substances will have work exposure limits. My first thing I would do if I was using a product with a wells would be to establish that first by reading the data sheet and do everything I possibly can to eliminate it.
Yeah.
Because you've got to then prove as a company that you're not exceeding the work exposure limit, generally given in parts per million.
Yeah.
So, if it says...
So is that like the time that you can legally expose somebody in an atmosphere using those chemicals?
Yeah, that's basically, it's a HC publication called the E04 where you will find the wells, but it'll also be given to you in your data sheet, and that data sheet will simply say, over an 8-hour period, you can expose somebody to 250 parts per million.
Yeah.
Without it becoming injurious to their health. If you exceed that, that's obviously a dangerous occurrence under the RIDDOR, but it's also breaking the law, because obviously you're now exposing
you're putting your employees at risk, aren't you?
Yeah. And there is a short-term time-weighted average as well over a 15-minute period.
Yeah.
Maybe that's an opportunity.
They've got a similar thing that they use in HAVs, haven't they, for work exposure limits in relation to hand-on vibration?
Yeah, we do, and that's arguably another good topic for a podcast. So let's just go through the hierarchies. Hierarchy: eliminate, substitute, mechanise, admin, and finally, as we've already suggested numerous times on these podcasts, PPE. Personal protective equipment is absolutely the last choice, because you are now exposing your employees to that harm.
Yeah.
You as a company have decided you're not going to do anything about the harm at source. We're going to create it, and we're going to expose our employees to it, but we're going to use PPE. Now, human error is the root of all accidents, as we know. So if that person is not wearing the PPE correctly, or it's damaged, or it's not maintained properly, or maybe they've been given the wrong specification, which has happened in the past, that person is now exposed to that harm.
So here's a question. As an employer, if I give my employees PPE, whose duty is it to make sure that they are wearing that PPE?
Yeah, that's a really good question. If you as a company have chosen to go down the road of PPE, which I've got to say is the last choice.
It's the last in the hierarchy.
So obviously that tells me, maybe there's a lack of training there, because obviously...
or understanding.
Yeah, exactly. So once you've chose PPE, you as an employer have got to make sure it's the right spec.
Yep.
And that it's being worn correctly via the supervisory process, that it's properly maintained, that you've given your employees somewhere to house it, some accommodation, something to clean it with, and you'll have to train them on how to put it on. Now, obviously, nobody needs training on how to put an overall on or a pair of gloves, but if it's something like a respirator...
A half mask or a respirator with a filter.
So why do you want to go down that road?
Yeah.
You know, a lot of people think, oh, it's only £2 for the sort of PPE, but as everything I've just suggested, that makes it the most expensive option. It's the first stage in a sequence of management responsibilities if you're going to issue PPE.
Yeah.
And as I've said before, human error is the root cause of all accidents.
Yeah, absolutely.
PPE is fine if you've got other controls further up the hierarchy. So if you've reduced
It's the last resort. It is,
and maybe you've got good systems, supervision. PPE might just be the sort of a third or a fourth level control.
Yeah.
That's fine.
Yeah. Safe systems of work.
Yeah.
That's another one. So obviously,
that falls into the admin controls.
Yeah.
Yeah. So how does a substance get into the body, Phil?
It can be inhaled.
Absolutely. The most efficient way of getting a harmful substance into the body is inhalation. So obviously, if you're atomizing, if you've got respirable dust, fumes, vapors, smokes, these are all things which your lungs can take into the body very, very quickly, push out those contaminants into the blood system. Absorption through the skin, absolutely right. So obviously the skin is the biggest organ in the body, and on the inside of the skin you've got lots of sort of a matrix of tiny capillaries which are maintaining and keeping the skin alive. So if you leave a chemical on the substance, a chemical or a substance on the skin for any period of time, you're going to be absorbing that through the skin. And then the final one is inadvertent ingestion. Now, we don't do this on purpose, eat freezing cold pieces of poison, but we could easily have a dust settling on a sandwich that we eat.
Yeah, so I think what you're alluding to is people eating their lunches in places they shouldn't be.
Absolutely.
So obviously, if you look under the management of health and safety at work, where they say that you provide suitable and sufficient welfare facilities, then obviously you need to then manage that and make sure that people are having their sandwiches and their breaks in a suitable place.
Absolutely right. So that will be a part of your risk assessment and your control regime, is that people have a break or a cup of tea away from that process area where they're using those harmful substances. So, most ingestion is inadvertent cross-contamination, as you suggested. Dirty hands, no welfare facilities nearby. People wipe their hands on their overalls and have a sandwich.
Yeah.
Well, there you go. Now, employees also have responsibilities, so be aware. Obviously, we've still got the Health and Safety Work Act 74.
Yeah.
Employees' responsibilities under Section 7 and 8. If you're interested in those, obviously have a little browse. But under the COSHH regs and every other regulation, we are enhancing those standard employees' responsibilities. So under the COSHH regs, you've got to work safely, no eating, no drinking in that workplace. Follow and employ all controls listed in that COSHH risk assessment. So that's really important. So you've got to train them on that risk assessment, get them to sign to say they've read and understood it, and they'll follow those controls. They've got to report hazards. Now, we're not very good at that. But if you as an employee see something dangerous, you have to report that.
Yeah.
And then finally, cooperate with an employer on all things health and safety, including COSHH.
So, from an employer's perspective, if I was to say to you, what is the difference between a reactive culture and a proactive culture, how would you define that under the health and safety banner?
That's a great question. I'm going to obviously sort of do safety management systems a bit later on, as a podcast in itself. But very, very few blue chip companies react.
Yeah.
Okay. Most blue chip companies have proactive regimes in place, inspections, auditing, checking that things are in place before they haven't cause an accident. I'm not saying that you shouldn't look at reactive data. Reactive data like accident stats and near misses and those things are very important, but obviously far, far better to not have the accident in the first place.
Would you, from an employer's perspective, would it be advisable to be like proactive?
Absolutely. I mean, I work with a lot of blue chip companies, and all the best companies have highly trained management and supervision. They've crossed that bridge. They realise the most efficient way of running their business is not to expose their employees to risks they don't need to be exposed to. It reduces the amount of accidents, incidents, dangerous occurrences. It keeps people at work You haven't got 50% of the workforce at home recuperating from an illness or an injury, so health and safety is the biggest profitability gain you have over your health and safety over your competitors. So training is essential. And on that note, Phil, I think that's a great place to finish.
Absolutely.
Thanks very much for supporting me on that. You've been a tour de force, and goodbye.
Hi, thanks very much for having us. Hope you've enjoyed our podcast today, Ken and Phil's Health and Safety Podcast. Obviously, it's designed for our suppliers and our partners to get access to health and safety and more formal training if you need it. You can reach us on our website, which is www.wolfcoal.ac.uk.